most famous physical therapist on the internet.
Bob, today I want to talk about stretching the psoas or the hip flexor. And as you know, there's like so many ways to stretch it, and oftentimes they're complicated. It's
Right.
like twisting into a pretzel. Well, this is the easiest, in my opinion, hip flexor stretch or psoas stretch that you can do at home,
At any age.
any age.
All right, Brad, how do we do this stretch?
Okay, so the hip flexors, I always tell my patients, where you put your hands in your pocket, they're right in
They're
there.
right there.
And they also go in deep up in
Yes.
underneath the stomach.
Difficult to get out.
They are. But this stretch, I would have to say, and maybe you agree with me. I think we talked about this before.
I concur, Brad.
Yes. So what we're going to do, and I have a friend right now. I think she's 71 or 72, and she's having this problem. And so I'm coaching her on this. And so on the edge of your bed. Now, if you have a soft bed, this gets difficult.
Right.
You want to grab the throw pillow for me?
And you also, Brad, you want to make sure you keep your shoulders well on the bed.
Yes. So I'm moving this shoulder as well on, move the hips to the edge so one leg can go
There
off.
you go.
Now, I've tried, my bed's a little soft. I put a pillow underneath my butt, and that works as long as things don't get slippery.
Sure.
It just helps a little bit, and you're gonna have to use your judgment on that. That gives me a little height if your foot hits the floor as well. So I'm just gonna let this leg hang, and you'll feel the stretch here, and if you don't feel it yet, grab this knee and pull it up, and that stabilizes the pelvis and puts a little stretch on there. And Bob, do you want to talk about where the knee should be?
Yeah, the knee should actually be somewhat straight
Yeah,
because we don't want to stretch the rectus femoris.
right. And we want to isolate that psoas. So if I go like this, that's not good. We want to keep that out and just relax then that
Show
position.
Brad how when you pull on this leg actually comes up.
Yeah,
So you can see he's stretching it.
yeah. Now, if you want to make it a little more aggressive, and it's really the most critical thing is that you relax
Right.
and breathe. I'm going to lock this in with this hand, and I can gently push down here. We're going to hold this for 15 to 30 seconds. If that's too much, take a break and bring this leg back up, let it relax, and then go back at it. And do this, 3 to 5 times.
Brad, can you use the massage gun when you're in this position?
That's a good point. So the massage area is going to be where the femoral creases, that's where your thigh ends and your creases where your belly starts. You can massage by hand, but it's hard. It's a deep muscle. So if you happen to have a massage gun, I would say use the one with the round head. Now, the big thing about this, it can work well and it feels really good. Just stay away from your glands right here, your
Right.
lymph nodes, because they don't like that beating on them. So I'm going to go here and start on my thigh and just kind of work my way up. I'm not going to go straight in, although you may be able to, depending on how aggressive your massage. This should feel very good. If it hurts at all, it's too aggressive. It's not the right thing for you.
And if you stay a little more to the outside, you're going to be
Yeah.
better off.
And actually that's what I like to do. I'll go here and I actually go back and I'll get some of the glute muscles
Sure.
and it just relaxes me and it feels good. So yeah,
Now, you can also have a partner come in and get a little assistance.
right. I'm going to give my leg a little rest before
Sure.
Bob helps. Now it's really critical that your partner who helps you, you trust them completely. If you don't feel comfortable with
Oh,
them,
Brad, you trust me.
well, I don't trust Bob for the video. You know what? I got to
Yeah.
do. No, so Bob is going to gently.
He's got witnesses.
Yeah. So gently stabilize here, and then his other hand is going to go here. Now, Bob, you're not putting very much
No, I'm
pressure on.
not.
Very little, and I'd say that's good.
Yeah.
You should not stretch to the point of pain. You should stretch to the point of feeling a
And
stretch.
you should be guided by the person receiving the stretch.
Yeah. So if I say hold, then Bob's going to hold. He's not going to bounce on it or do
Right.
any silly things like that. Again,
Alright.
that person has to be a very confident person that you feel comfortable
Want to
with.
show off the edge of the bed,
Yeah.
Brad?
If you don't feel comfortable on the edge of the bed, we'll go to the other option is go to the end of the bed, sit down. This doesn't work, obviously, if you have a big foot rail or whatever you call that, headrest,
Right.
footrest. So here I am, I sit down, and now you don't have that feeling of falling off. I'm gonna grab here, and I'm just gonna let that leg hang. Again, I can do it manually. You can do the massage gun the same way. If Bob wants to come in, it's probably a little easier for someone to assist. Hold that leg, Bob. Now push this one up a little bit. Yeah, that feels better when you do it that way.
Sure.
And so that's what you can do. You need to be able to instruct your assistant how to do this. Well, Bob and I have done this on patients over the years,
Right.
and you learn.
We have a good feel for it.
Yeah. The nice thing about the end is you can do both sides. Usually
Right.
there's one
You
tight.
can flip around. and-
Otherwise, you got to flip around in the bed, and it's
Right.
a lot of gyrations. Bob, my whole right hip is feeling so
Yeah,
much
you're
better.
way off on the left,
Yeah.
left side now.
I walk in circles.
Yeah.
So very good. Good
All
luck with
right.
that hip psoas and hip flexors. You'll do well with this. Take your time and be careful.